Welcome to our video about halitosis treatment. If you're looking for a halitosis treatment, you've probably come to the right place. This video will discusses the physiologic causes of halitosis, PDT, saline nasal spray, and other treatments. You might also be interested in learning more about some of the illnesses associated with halitosis. These conditions can be caused by an infection, illness, or other factor. Physiologic halitosis. Physiologic halitosis is a common disorder affecting the oral cavity. It can be caused by several factors. In the case of chronic halitosis, the cause is not always understood, but the current treatment modalities can help clinicians cope with the condition. Successful therapy should be individualized for each patient, and the psychological aspect of the disease must be taken into account. To determine the underlying cause of the disease, 3 questionnaires have been developed. The initial diagnostic tests used in physiologic halitosis include organoleptic measurements, sulfide monitoring, bana test, and salivary incubation. However, these tests require specialized instruments and may not be appropriate for patients with mild halitosis. In the case of chronic halitosis, additional measures may be necessary to treat the condition, such as undergoing surgery. Physiologic halitosis has 3 types. Type 0 halitosis is a composite of all these types, and it can appear in one or more combinations. In a healthy person, bacterial activity on the mouth and respiratory tract mucosae is normal and gastroesophageal gas leakage is minimal. Types 1 to 5 are present in healthy people in minimal amounts, and their relative contributions are different within an individual. Physiologic halitosis treatments have been successful in treating a variety of cases. It is important to note that the treatments used in physiologic halitosis are not effective for the treatment of psychosomatic halitosis. Physiologic halitosis is a symptom of a bacterial overgrowth in the oral cavity. In patients who suffer from halitophobia, however, treatment is often unsuccessful. In humans, body odors play a vital role in mate selection. A bad odor may signal disease or an unwise mate choice. Over time, social stigma about bad breath has likely changed and exacerbated, as a result of advertising pressures. Despite this, the psychosocial aspects of halitosis are more widespread than in the past. Halitophobia, for example, has become a common psychiatric condition that requires medical intervention. The basic physiologic halitosis treatment involves tongue brushing and mouth rinsing. A number of studies have shown that tongue brushing and mouth rinsing are more effective than mouth rinsing, but halitosis-phobic patients must receive treatment in both types. It is important to remember that mouth rinsing is only one form of treatment for halitosis. PDT. Combined with tongue scraping, PDT has been shown to significantly reduce H2S and oral pathogens. PDT is an effective treatment for halitosis, but it is not without risk. PDT uses a laser system called the Therapy XTS, TM, which has a red, 660 nanometers, and infrared, 810 nanometers, wavelength. Treatment is painless and requires only minimal preparation. Patients are provided with protective garments and an aspirator. Dosimetric parameters for PDT are chosen based on the clinical outcomes in patients treated for halitosis. One study of adolescents showed immediate positive results with PDT at the dorsum of the tongue, probably due to reduced VSC. Unfortunately, no studies have been conducted on the effect of PDT on halitosis in older adults with full dentures. The authors of the study recommend that future studies focus on this age group. The present study looked at a randomized controlled clinical trial of PDT in adolescents with halitosis. Results from 2 trials showed that PDT reduced intraoral microorganisms and maintained the oral microbiota. However, it did not work in older patients. Its use should be studied further to ensure that it is effective for halitosis in adults. And it should be noted that PDT can be effective for a broad range of conditions, not just for individuals with severe cases of the disease. Another study found similar results. PDT was associated with a significant reduction in total volatile sulfur compounds in all 3 groups. But Group 3, tongue scraper and PDT, showed the greatest reduction. The APDT group also showed a statistically significant difference from the tongue scraper alone. This suggests that APDT can have a positive effect on halitosis. And it doesn't involve mechanical aggression of the tongue. The study's participants will be aged 60 and older with complete dentures. The two groups will undergo treatment for halitosis and are assessed after a week. The study will be repeated after 1 week and 3 months. The researchers will then evaluate the quality of life of the participants. They will also be evaluated at the baseline and after the treatment. If the treatment does improve halitosis, the results should be reported. Saline nasal spray. If you're suffering from halitosis, you may be using saline nasal spray as a treatment. This solution is made of saline and contains an antibacterial agent. The spray is also known to reduce the amount of sulfur-producing bacteria in the mouth. If you don't want to use saline nasal spray, consult your doctor or dentist about the best way to treat your halitosis. Bad breath is embarrassing and can affect your confidence. In some cases, it can even affect your work or social relationships. Fortunately, there are many products available to help you overcome this embarrassing problem. The Sinapulse Elite is a nasal and throat irrigation device that can help you eliminate halitosis and eliminate the odor in your mouth. Its soothing and effective effects are well worth the money you'll spend on the treatment. Approximately 90% of cases of halitosis are related to oral problems. Tonsillitis and tonsil stones can cause halitosis. Sinusitis is another common cause of halitosis. The sinuses are a moist environment, and often fill with mucus. These problems can make it difficult to eliminate the mucus and bacteria responsible for bad breath. Aside from saline nasal spray for halitosis treatment, doctors may also prescribe medications that contain steroids. Although these medications are not available in the United States, budesonide is commonly sold as a nasal wash. It's dissolved in saline to help clear mucus and open the sinus drainage pathways. Saline nasal spray may also help prevent halitosis by neutralizing VSCs in the mouth. Other treatments. While it is important to see your dentist for a diagnosis, some people have bad breath that can be treated at home. Flossing and brushing after meals are essential in controlling halitosis. Bacteria grow in the mouth cavity faster than they are removed, so not brushing and flossing after meals can exacerbate the condition. The most effective way to combat bad breath is to remove food residue. Home remedies for halitosis may not work as well as dentist-recommended procedures. Although deep cleaning of your teeth can temporarily fix the problem, you need to address the underlying issues to get rid of halitosis for good. Brushing your teeth twice a day, flossing after each brushing, and using a mouthwash may help reduce the occurrence of halitosis. There are a variety of medical conditions and personal habits that may cause halitosis. You may not be aware that you have halitosis, or you may have developed a tolerance to the smell. If you feel your halitosis is affecting your social life, it is vital to seek medical advice. Those who smoke often experience bad breath due to nicotine withdrawal. Tobacco users also suffer from gum disease, which contributes to the bad odor. Foods that cause indigestion or heartburn can also lead to halitosis. If you're not seeing improvement after a few hours of using mouthwash, your doctor may suggest that you see a dentist for a proper diagnosis. Your dentist can check your gums and teeth for other causes of halitosis, such as infection or undiagnosed medical problems. If the problem persists for more than 24 hours, you may want to consult a primary care physician. In addition to brushing and flossing, there are a number of other treatments for halitosis. These include antibiotics, medications, and dietary changes. Depending on the cause, you may need to alter your diet or change your insulin regimen to improve your breath. Your dentist will be able to advise you on the best way to treat your halitosis. They can prescribe the right medication for your condition. We are so grateful that you stayed to the end.